Thanks so much for joining us. I appreciate you making the time to come today and playing with a new online communicating platform. So thank you for bearing with those changes. I'm Heather Kay. I work for Quintana Saragossa Public Affairs. We've been partnering with Western Dental for years, and really kind of helping them tell the story of their community outreach and really just making sure they're seen as not just in the community as a building or a service, but as part of the community in which they operate. So we really appreciate your time today and ability to kind of tell a little bit of our story and answer any questions you have. But we wanted to talk a little bit about what we do, our presence in your district, and then make sure that we address any questions or thoughts you may have. So with that, I just want to thank you for being here. And my colleagues are going to jump in a second, but everyone should know that Amanda Berry is here from Supervisor Terra Lawson Remer. Did I say that correctly? Is it Remer?
Remer.
Remer, okay. Remer's office, and she is the advisor for Health and Human Services. So she has a pretty large and very, I'm sure, busy portfolio during a pandemic. And I'd like to introduce my colleague, Edwin Rivera. Edwin is part of the Western Dental team. He is our Vice President for Community Engagement and Strategic Alliances. So with that, I'm going to turn it over to Edwin, and we'll get going.
Thank you, Heather. Thank you for the introduction. And Amanda, welcome. It is a pleasure to meet you virtually. And thank you very much for joining us today. We wish that this visit would be in person, but due to everything that we're going through right now in the state and the region, this is the safest way to do it. So we virtually welcome you to Western Dental. As Heather said, I'm Edwin Rivera. I'm Vice President of Community Engagement and Strategic Alliances for the company. And today we're going to give you a virtual tour of our dental clinics. With us today, we have Tiffany Tucson, who is our Operations Director and lives in San Diego. There's Tiffany.
Hi, Tiffany.
And then we're also lucky to have Dr. Sumava Sen, who will talk a little bit about the clinical aspects of the clinic. And Dr. Sen has been with us throughout his entire career. So Dr. Sen is there on camera now. So now we're all on camera. And like I said, Dr. Sen has a great experience. So he's not only an expert on dentistry, but he's also an expert on Western Dental. And here at the company, we strive to be part of the communities that we serve. And that is why we engage in partnerships with local nonprofits, as well as other organizations such as chambers of commerce, Mexican consulates, and elected officials such as Supervisor Lawson, for which we will make ourselves available for any oral health questions or participate in any events that you might have in your constituents. So with that, if you can give us a little introduction about you, Amanda, that would be great.
I'd love to. Thank you so much for having me today and doing this virtual tour. I like learning a new platform, so appreciate this as we try this out. So my name is Amanda Berry, she, her, and I am a health policy advisor for Supervisor Lawson Remer in District 3 at the county. My background is in social work and public health. So I approach the work with the supervisor. She's really focused on dignity and worth of the person. And a lot of our initiatives are around the social determinants of health and how we can really impact what happens at the county in terms of looking upstream, providing services and care for the entire family, the entire person. And so it's a little bit about the background. I do have quite a large portfolio with Health and Human Services. We have a couple other folks on our team that work in health and some of its intersections, but really looking forward to learning about all of you today and getting the tour and then learning how we can be partners in the work. So let me know if you have questions, and I'm definitely a question asker. So if I have any, if you don't mind, I'll just jump in as we go through, or I can wait till the end.
Oh, we can do it, whatever is easier for you. I love your background. That's kind of my background too, especially when it comes to serving underserved communities. And so I'm pretty sure we're going to have a great conversation today. And you mentioned that the county level and everything that happens. So in the San Diego area, we're active participants of the Health Department's Oral Health Coalition. that is led by Dr. Ollinger. And we also partner with schools to educate students and parents about oral health. We think collaboration with these groups is extremely important in order to bring the important message of oral health to our communities. Today, our company president was not able to come with us and be a part of this, but we have a message from him on video that will tell you a little bit about the company. And after that, we'll have an opportunity to answer any company-specific questions before Tiffany and Dr. Sen go in. So with that, can we see the video from
Miller,
Jeff?
President of Western Dental and Orthodontics. Thanks for joining us today for this virtual visit. We wish we could be together so that you could see the smiles of our team members and our patients in person, but that day will come soon. Western Dental has provided high-quality dental care for a really long time. In fact, our first office was opened 100 years ago in Southern California. We've grown quite a bit since then. We now have 240 offices in California and 340 offices in 5 states. We have great people who work here. We employ over 5,000 team members. Our doctors, hygienists, assistants, technicians, and all of our staff live right here in the communities that we serve. We have over 1,100 dentists. We have general dentists and orthodontists, but we also have a network of oral surgeons and board-certified specialists. We're unique in that we provide comprehensive services, not just general dentistry, but specialty care as well. And we can provide it across the lifespan. We treat kids on their first birthday, and we're able to address the unique needs of older adults. We are proud to accept most forms of insurance, including Medicaid and Medicare. We are the largest provider of oral health care services to the Medi-Cal program in California. We've been honored to work with the state over the last decade to transform the Medi-Cal dental program. That's resulted in hundreds of providers joining the program and increased access to oral care services, both for kids and for lower-income adults. We're excited to continue to work with the state as the Cal-AIM program transforms Medi-Cal over the next decade. On behalf of all the Western Dental doctors and employees, I wanted to thank you again for joining us and spending a little time with us. Look forward to being with you again really soon.
Okay, and with that, we send a virtual thank you to Jeff, our fearless leader. And Amanda, if you have any questions so far while we're talking, we're still going to talk a little bit more about specifics in the region, but any questions?
I'll let you keep going on the specifics.
Okay.
Go ahead.
Perfect. So as Jeff said on the video, Western Dental has been serving our community for over 100 years. So now we're gonna play another video so you can take a look at what we do. So there's no sound, but here I am. So we've been over 100 years, and we are one of the nation's largest providers and the leader of accessible, affordable oral health care. We have 240 locations across California, and 16 of them are in your area in San Diego. And we also have offices in Texas, Arizona, Nevada, and Alabama, for a total of over 340 offices, and we continue to grow as a company. At our company, at Western Dental, we provide a full range of dental services. We employ over 600 doctors in California and over 1,000, including the states that I mentioned previously. Our doctors are licensed and board-certified dentists, and also beside general dentistry, we offer all services, our oral health specialties. And that is one of the reasons that we're proud to call our clinics a dental home for the whole family. We're also proud to say that we have always had state-of-the-art safety protocols, which have been enhanced during the last year and a half for obvious reasons, and have helped us maintain both patients and team members safe throughout the pandemic. We're one of the first large practices that opened back in July of last year, and we are fully open and operational right now in all the regions. We are the largest provider of medical dental in California, and we will help our patients finance treatment that might not be covered by Medi-Cal, such as orthodontia, for example, so they can get the needed care that they need, within their budgets. We're also open non-traditional hours and usually are open Saturdays and late evenings for appointments if available. So as you can see, we are more than a dental clinic. We are a partner of the community. We care about their oral health and want to educate them on the importance of keeping your mouth healthy. Now I would like to introduce Tiffany, who will give you some specific details about the clinics in the region. So Tiffany.
Thank you, Edwin. And thanks, Amanda, again for allowing this platform and this conversation to happen. The Director of Operations for the San Diego region, also a third gen San Diego native, just like Supervisor Lawson Remer. So it's very cool to see some of her um, best focuses and be within the environment. Um, I've been with Western Dental for 4 years now in this, supervisory position, and a lot of my passion comes from the fact that we're able to serve all patients, no matter the payer type, no matter the budget, on services that they don't oftentimes get the chance to do, like implants. They don't have the chance to sit down with a board certified oral surgeon and have them do services. So a lot of my passion comes from us being able to change patients' lives in that aspect, and really trying to bridge that gap between that oral systemic link between oral health and overall health, and trying to really get into the communities and educate them. I've been able to, within these 4 years, really learn from Dr. Sen, who's our clinical director. He's been with the company for over 30 years practicing dentistry. He's also an implantologist as well. But a lot of knowledge and a lot of my passion stems from all the wonderful work he's been doing. Dr. Sen, do you want to tell a little bit about yourself to Amanda?
Yeah, first of all, Amanda, thank you and welcome. Actually, I was writing your biodata because I'm going to go home and send your biodata to my daughter and brag that I had a chance to talk to you, because she went to UC Berkeley for public health and now she's in a law school. But she really, really wants to do this, what you are really, really doing. So I am hoping someday she can follow your footsteps. So great job you're doing. Thank you for that. Been with the company, as you heard, for 28 years. Came from India. This was my first job. Still with the company. My wife thinks I'm kind of lazy. That's why I couldn't find another job. That's why I'm with the Western. But I look at it in a different way. I love this company. I like working with every single people I work with. I love doing whatever I do as a doctor, as a clinical director for the patient. And as you heard, in this world today with pandemic and everything is going on, the biggest concern for everybody really is the safety. And I can assure you this much: this is probably the safest place anybody can come in and get their dental treatment. When it comes down to the sterilization and the other protocol related to your COVID and the things, we are extremely conscious, and I think we have done a great job navigating through all the challenges we have. You heard from Edwin, it's more of a dental home, but before you go into the dental home, this oral health is related to your overall health. It is not just the teeth. We look at it, 30, 32, 28 teeth. No, it has everything to do with your diabetes, high blood pressure, and everything, your overall well-being. And as a clinician, we really look at the whole picture than just the teeth. And as Stephanie mentioned, when the patient come in, regardless of their insurance, whether you have a medical, whether you are cash paying patient, insurance, or whatever insurance you have, we try to give the best possible treatment for the patient. The insurance doesn't dictate what should be the best possible treatment. We provide that as a clinician, what is the right thing to do for the patient. Patient doesn't really like to go one place to another place to do specialty work. So that is where the concept of dental home came in. We have a board certified oral surgeon, board certified periodontist, sedation, kids doctor, root canal doctors, everything under the same roof. So it's a one-stop thing. You come here, get everything done, and the patient goes home happy. But more than anything, I take a lot of pride with the community service. We are into the remote locations where the dental care is extremely unavailable. We go there, provide it. We get into our community service, and happy to help the community and your community to the best of our knowledge. But that being said, thank you very much for having us and joining us. Thank you.
Thank you, Dr. Sen. So, as Dr. Sen said, we are in this in all the communities, and I know Heather has some information specifically to your district and the number of patients that we have there, etc. So Heather, you want to talk a little bit about that?
Absolutely. So in San Diego County as a whole, the Medi-Cal population is around 936,000 people. At our facilities in your district specifically, so just we're going from a county number to a district number, we had served over 16,000 Medi-Cal patients since we reopened last July. And we had over 3,400 new patients visit us since last July. So we're starting to see things ramp back up, but we've been able to really drill down and get into back into the community and start seeing folks to make sure that they're maintaining their dental health and overall health.
Yeah, thank you, Heather. And that shows, when I mentioned that we like to be part of the communities, this is just part of it. We serve, we are the largest Medi-Cal provider. Thus, we are usually the only ones that accept Medi-Cal in certain areas of the cities, right? And I remember when we first joined the Oral Health Coalition in San Diego, and we started having those conversations, they were surprised because San Diego is an area that they have a lot of problems finding doctors who can accept Medi-Cal. And us being the biggest in the area with 16 clinics, we're open to do that. So we have done some events with them. We have done events with the Mexican consulate throughout the Binational Health Week, just to reach out to these communities that really need our help on oral health. And I love what Dr. Sen said. Many times we forget the relationship between your mouth and your body, which is like very, very, very important. So that's part of what we do. So
thank you for that.
Questions?
Yeah, I have a few. I think to start, the Oral Health Coalition, I'm not as familiar with the coalition, so maybe you could tell me a little bit more about that and its connection to the county.
Yeah, definitely. Yeah, the Oral Health Coalition has been going around probably for a couple of years now. And Dr. Ollinger, he's a dentist, and he's the chief dental officer for San Diego County Health Department. And he is very passionate about service to the community. So they created this group where we participate, but the county participates. And there's a lot of there's some FQHCs that are part of this, as well as other community organizations. And the goal is to make sure that the people in the community understand the importance of oral health. But also every year they do this meeting where we bring a lot of people together to talk about what's happening in other counties and what can happen in San Diego, what kind of best practices. So that's basically what the coalition is. And we can talk offline. I can give you some more details if you want, and give you all the information that happens. Tiffany attends all their meetings, and I try to attend to when it doesn't conflict with everything else that I'm doing. But it is one of the things that I love about San Diego. It's one of the few counties in the entire state that actually has a chief dental officer, which shows that they understand that importance between oral health and body health.
Definitely, thank you. I want to learn more too, so that I can find out where the supervisor can play a role if needed, and uplift some of the messages and some of the work that's being done. We find that sometimes you need a board office to help advance some of the initiatives and the policy priorities that come out of coalitions like that.
Mm-hmm.
I'm curious, during the pandemic, I think dental offices were hit really hard with some of the closures, and we know how important oral health is to physical health in general. And so I'm wondering what you all are seeing and how you're kind of playing catch up, and if you are playing catch up to do outreach and get people in. I mean, even in my own circles, a number of people are like, well, I haven't been to the dentist in the entire pandemic, and they're finally going back and getting their checkups and things like that. So curious what you've seen and what you're experiencing in terms of what you need to do to close the gap, both on the community level, but also on your own operational, financial level to catch up from the missed.
Yeah. Yeah, definitely. I'm going to let Dr. Sen answer most of that question, but I just wanted to put 2 cents there about, our offices were closed for about 2 months when the pandemic started. We left about 14 offices open, and they were like the emergency room gateway. So people didn't have to go to the emergency room if they had a toothache or something like that. So we had our call center open and we're able to do that. And during that time, we kind of like enhanced our protocols of dental care and especially of safety. From in the lobby, we used to have 30, 40 chairs. Now there's only like 5. So, prepare, making sure that we have that distance between patients and between staff and patients. Everybody's mandated to wear masks at the clinics. We have like a different like plexiglass divisions in some of the reception area. People come in and we say, hey, can you wait in your car, and we'll text you when we're ready for you. So just to avoid that congregation. So it did affect our operations when it comes to that. But then back in July, we were all operational. We were able to open all the clinics. As I mentioned before, we were one of the first large dental companies that came online. And what I said online, I mean live.
Like even though you're open, did you have the demand from the community? Because I feel like even in July, people were like, "I'm not going to the dentist.
Yep.
Like I'm not going anywhere."
Yeah, we had some of that. So what we emphasize on our outreach to the community and in meetings like this was that it is safe to come to the dentist because of everything that we do in our offices. So yeah, it took a little bit to ramp up, but I think now we are back to as normal as we can be under the circumstances. Dr. Sen, you want to add something to that?
You brought up a very good point. How was the demand during this shutdown? And during that time, me along with some of my other colleagues, clinical director, we are doing emergency services. And I tell you what, on average, I was serving about 120 to 130 patients calling me for the emergency things that was happening to them. So when we opened up, there was a huge demand. Even though it is more of emergency, like people wants to take their tooth out, things like that. We have done it for a month. And after that, we really ventured into a full service dentistry. The trick here is, as long as you are cautious, you are doing the right thing in the right way, people are safe, doctors are safe, staffs are safe, patients are safe. We did maintain the social distancing, even inside the clinic, where every third chair we should be utilizing. And there was a plexiglass in between our operatories. We had our the air circulation system. Again, mask was mandatory. Even before patient comes into the office, we took that temperature. We have this questionnaire about 6 to 8. We still do it. We are still taking the precautions. But that being said, we are very close to be back to our 2019 level, our procedure and service-wise. So operationally, we are about to be back. But that being said, yes, there was a huge demand. And again, even if when you have COVID, it is utmost important for you to have an oral health care. Because you know what? The oral bacteria can actually trigger the effect of the COVID symptoms. So you take care of your gums, you take care of your oral microbes, your reactions to the COVID symptoms is going to be a lot less. And we have products, we have things to do so to minimize those COVID symptoms. And we have done it successfully so far. Yep.
Thank you for that. I appreciate it. I think the last question I have is about some of the work that the county is doing. I know we do like fluoride treatments for youth, and your executive director mentioned CalAIM and the changes in Medi-Cal that are coming. So we only have a couple more minutes, but I wanted to ask what you're seeing as kind of the next big thing for you all, and how that relates to what we could do from the county seat.
Yeah, we definitely want to be totally back to normal. And what I mean by that is making sure that we start that work that we did with schools before to provide oral health education there, as well as being part of the community, in the community events. We in the LA area, for example, we're starting to do some vaccination clinics together with some nonprofit partners, just to make sure that people are aware of that. We don't do it inside our clinic, but we do like the pop-up vaccination events in our parking lots, so people are aware of that. So that's how we are kind of transitioning to the other part. And I don't know if Dr. Sen has something to add to that.
To your point, Amanda, what Western Dental truly believes is that prevention is the best treatment. Even before you go into your cavities, root canal extraction, we do want to treat everybody at the ground level, where you brought up fluoride, we do sealants, just to make sure all the kids coming in, regardless of the insurance or whatnot, they are all healthy. Less cavities is good for the community, it's good for the overall health. That is really the goal of Western Dental. Prevention is the best treatment. And if we can achieve it, we can actually take a lot of pride as a successful organization. And the success of organization is not just on a dollar amount, it is what kind of an impact you can have on the community. And Western is very conscious and really diligent about doing it.
Great. Thank you. Any other asks of me?
Well, what I would like is like for us to keep in touch, keep in communication, especially because we have such a large number of clinics in San Diego. And if the supervisor has any events, any community events that she would like us to be part of, we're here. As well as if there's any questions regarding oral health or regarding policy and all of that. Us being the largest dental provider in the state, will give you an opportunity to learn a lot from the data that we have. So if there's anything that we can do on that aspect, we are here. We welcome you. I welcome your questions, your suggestions, and whatever we can do for you. And also eventually, hopefully, both you and the supervisor get to come to one of our offices and see it in person, so you can learn a little bit more about us.
Yeah, I think too, Amanda, one, thank you for your time today, but two, we'll get you some links and information on that Oral Health Coalition, and I'll also email you over the data that we talked about during this presentation. But always think of us as a resource if you're working on anything related to dental care or doing, as everyone touched on, community events. Please let us know, because we're in the community, but we're always looking for opportunities to kind of expand our reach and make sure that folks are getting access to care. So please keep it in mind.
Yeah.
Will do. Thank you so much. I was just doing a tour of one of our homelessness facilities, and one of my first questions was, they've partnered with the community clinic, and I said, do you do dental? Because it's often something that's missed in a lot of the outreach. You know how important it is for health. So thanks for the work that you do in our community to serve people and keep them healthy, from their mouths to the rest of their body. And I look forward to working together, and please don't hesitate to reach out if there's anything that we can do to help you.
Thank you so much. Thank you for being with us today.
Thank you.
Thanks for your time, Amanda. Have a great weekend.
You too.
Okay.
Bye.
Okay. Bye-bye.